Hello, I am Sandra Seebeck, and I am speaking today about the role and responsibilities of community and public health. Public health regards the community as its patient. Public health is the science of protecting and improving the health of communities through education, promotion of healthy lifestyles, and research for disease and injury prevention. It is also a field that is concerned with limiting health disparities, and a large part of public health is the fight for health care equity, quality, and accessibility. Public health is achieved through the cooperation of local government programs and community leaders and organizations. Public health is different from clinical health as it regards the community as its patient. The role of community and public health in the well-being of populations. 10 essential public health services according to the CDC. The Core Public Health Functions Steering Committee developed the framework for the essential services in 1994. The committee included representatives from U.S. public health service agencies and other major public health organizations. The role of public health is to monitor health status and identify community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services, and assure the provision of health care when otherwise unavailable, assure a competent public health and personal health care workforce, evaluate effectiveness, accessibility, and quality of personal and population-based health services, research for new insights and innovative solutions to health problems. Public health organizational structure. The organizational structure is made of people and organizations on the front lines of public health, such as health departments, community and neighborhood health centers, primary care delivery systems, and public health institutes. These partnerships will help strengthen the nation's capacity to deliver public health services through public health departments and community organizations. Martin Missner describes public health as an organized activity of society to promote, protect, and improve, and when necessary, restore the health of individuals, specified groups, or the entire population. It is a combination of sciences, skills, and values that function through collective societal activities and involve programs, services, and institutions aimed at protecting and improving the health of all people. Ethical dimensions of community and public health versus individuals. Healthcare has long been geared toward the individual's rights and ethics. The recent pandemic of influenza seemed to have pulled the ethical concerns even further away from the concerns of public health. Individual rights, clinical ethics, and research ethics are not a good basis upon which to build public health ethics. Public health ethics need to be population-focused with an approach that is geared toward the needs of the public and communities as a whole. The concept of individual justice needs to broaden to become social justice that is more interdependent with the focus on community and the public. For public health services. The House of Representatives passed the $1.01 trillion bill for fiscal year 2014 yesterday, and Senate approval is expected by the end of this week. The action follows an agreement between the House and Senate negotiators announced earlier this week. The bill provides increases for the Centers for Disease Control and Prevention and the Food and Drug Administration, and the first appropriation for pandemic influenza preparedness at the Department of Health and Human Services since 2011, according to congressional documents and Congress watchers. Legal dimensions of public and community health services. Many articles and websites spoke of the need for states to modernize their current laws in regard to public health. One such program is the Turning Point Initiative. The Turning Point National Collaborative on Public Health Statute Modernization seeks to transform and strengthen the legal framework for public health through a collaborative process to develop a model state public health law to better protect and promote the public's health. Funded by the Robert Wood Johnson Foundation as part of its Turning Point Initiative, the collaborative is a multidisciplinary group comprised of representatives from 5 states, 9 national organizations and government agencies, and experts in specialty areas of public health. The Centers for Law and the Public Health work with the Robert Wood Johnson Foundation to improve our public health through legal reforms. The Robert Wood Johnson Foundation finances through grants in different states projects to seek improvements. The RWJF website states, "Our vision is for us as a nation to strive together to create a culture of health, enabling all in our diverse society to lead healthy lives now and for generations to come." Public health services organizations and community leaders and programs must communicate and work together toward the system management through policy development, assurance, and assessment in order to implement and improve public health. Through organizations like the RWJF Foundation and local community programs, people can access basic health and emergency services when needed. Continually working to improve the public health system will be there for all citizens.